Good morning and welcome to today's webinar, Positive Deviance, Outliers as a Strategy for Solving Social Problems. This is one in a series of free webinars hosted this month and every month by Equiate as a service to those working to address health and social problems. This may be your first introduction to Equiate. If it is, we welcome you. We're glad you're here. Equiate's a new organization, a consulting firm based in Alberta, Canada, focused on solving health and social problems. My name is Steve Peterson. I'm the founder and managing partner of Equiate. I've been working in this field since graduating from Yale University in 2005 with my master's in public health. So even though Equiate is new, the ideas and projects it is founded upon are not. I'm excited that you've joined us for our webinar today. Just to orient you to the interface, you'll see at the top of the screen a My Mood icon. If you hover your mouse over that, it'll give you some options to raise your hand for the questions and answer session of the webinar, or to go to thumbs up, thumbs down, that sort of thing. This webinar will follow the format of introducing the concept of positive deviance, describing its application in a few case studies, describing current activity we are involved with, and sharing a framework for those interested in applying positive deviance in their work. When I first came across positive deviance years ago, it was exciting. It was one of those moments that was eye-opening, creating a sense of possibility and potential that changed how I viewed the world. Difficult problems, wicked problems as some refer to them, had a match, a foe that could overcome them. I hope to be able to pass some of that sense of excitement along to you today. First, let me address one of the biggest challenges with this concept, the name itself, a positive deviance. It often puts people off. I once had a phone call with a well-known personality who had worked for National Geographic and had done amazing work all over the world, trying to introduce them to the topic of positive deviance, as I thought it would be a perfect method to help further some of their work. This phone call went a bit awkwardly, as the person I was speaking to couldn't see past the name. They were even doing an internet search while we spoke and found terms like cognitive dissonance and others that sounded perhaps similar but were completely different. Needless to say, this conversation was not very fruitful. And I'm sorry to say, the very name positive deviance remains perhaps the largest obstacle for those interested in or doing this work. It's getting past the, pardon me, reaction to the name. For those that do, the journey is incredible and people get hooked. This is a topic that creates passion, but its name is an obstacle. There's no denying that. So what is meant by positive deviance? How are we to understand it? In their landmark book on the subject, Drs. Jerry and Monique Sternin and Richard Pascal describe positive deviance as an awkward, oxymoronic term. The concept is simple. Look for outliers who succeed against all odds. Outliers are something we may be more familiar with. From Malcolm Gladwell's excellent book of the same name to Sean Acor's outstanding TED Talk, the drive to increase our understanding of outliers, what makes them so, and what, if any of that, can transfer to other people is intriguing, widely understood, and extremely fascinating. Positive deviance focuses on understanding outliers in its first phase and has as its foundation the idea that at least one person in a community working with the same resources as everyone else has already licked a problem that confounds others. This is what makes positive deviance different than outliers. If you've read Malcolm Gladwell's book, you might remember the story of Bill Gates, who at a young age had almost unlimited access to computers at a time when computers were expensive, large, and quite rare. This access fed his passion and eventually led to Microsoft. Malcolm Gladwell's comment was, well, if there had been more access to computers for more young boys, perhaps we'd have 100 Microsofts today. See, Bill Gates had something unusual that most people didn't have. Positive deviance, while it focuses on outliers, focuses on people who find solutions with the same resources that everyone else has. And in doing so, they lick a problem that confounds others. Now, intuitively, this makes sense. Consider the worst social or health problem you're aware of, one whose statistics are horrible. Even in this scenario, your indicators will not be 100%. The problem is not a universal problem. It's a problem, no doubt about that, but it is not a universal problem. Someone, somewhere in the very same population where this difficult problem exists, with the same resources as everyone else in that population, has overcome the problem. For example, one of the early case studies of positive deviance described by Dr. Sternen in their book focuses on child malnutrition in Vietnam. Child malnutrition was a very serious issue, closely linked to poverty, and very closely linked to extreme poverty. Yet when the project team and community looked closely, they could identify children in poverty and extreme poverty who were not malnourished. These outliers, these positive deviants, became the key to understanding how to unlink poverty and child malnutrition and improve the health of Vietnamese children. But positive deviance is more. It's not just about identifying and understanding outliers. It is also a highly effective participatory change tool and method. It has been applied successfully to address issues as divergent and difficult as female circumcision, hospital infections, girl soldiers, human trafficking, and infant mortality. The change process part of positive deviance is best introduced with insights from Dr. Sternen again and their experience in Vietnam. As related in their book, after they had discovered that positive deviance exists and what made them so, they reflected, and I quote, "They reflected on their past development work failures. All had occurred exactly at the moment in which we now found ourselves, the moment at which the solution, aka the truth, is discovered. The next, almost reflexive step was to go out and spread the word, teach people, tell them, educate them. Bingo. Reflecting on those failures, we realized that they occurred because we were acting as though once people know something, it results in their doing something. By the time we reached Hanoi, this wide-ranging discussion was distilled into an epiphany, despite our fatigue and grittiness. What we needed to do was create an opportunity for people to practice, rather than merely know about, the successful positive deviance behaviors the villagers had just discovered. The process of self-discovery was every bit as important as the actual behaviors uncovered." End of quote. This focus on practice as the means of knowledge transfer, not information sharing, is at the heart of the second phase of positive deviance. Once outliers are identified and understood, a process or system must be created that can allow others to learn these behaviors through practice, not information sharing. One additional perspective on positive deviance we would like to introduce is the perspective of systems theory, again through a story, this time not about child malnutrition in Vietnam, but of female circumcision in Egypt. Female circumcision in Egypt was a practice that was culturally entrenched and affected 97% of girls. It was both tragic and intimidating. Positive deviance was successful in mobilizing families, communities, and a whole culture to make significant improvements on this issue. Key to success here and elsewhere is that positive deviance does not seek to introduce a best practice or foreign solution to a skeptical community, but focuses on solutions already proven within a system or population, bypassing any system or cultural barriers. The solution is already owned. It just needs nourishment to grow. Let's summarize what we've discussed so far. Positive deviance is founded on the idea that at least one person in a community working with the same resources as everyone else has already licked the problem that confounds others. Positive deviance focuses on statistical outliers, people whose experience deviates in a positive way from the norm. Positive deviance is a highly effective participatory change tool and method. Positive deviance utilizes hands-on experience and practice as the means of knowledge transfer, not information sharing. Positive deviance focuses on identifying and spreading solutions from within a system or population, rather than introducing foreign solutions from without. Let's build on this understanding of positive deviance by reviewing a few case studies, drawing from the growing literature on this subject. For the first case study, let's focus on the experience in Vietnam, already referenced in our presentation. This case study is told by Dr. Sternen in their book on positive deviance, and is in many respects the bellwether case for positive deviance. We will quote excerpts from Dr. Sternen to describe this case study in brief for today's webinar. Told by Dr. Sternen. In 1990, about 65% of all Vietnamese children under the age of 5 suffer from some degree of malnutrition, an intractable problem for a country under a U.S.-led economic embargo. It was clear to the government that traditional supplemental feeding programs provided temporary solutions at best and were unsustainable. The U.S. NGO Save the Children received an invitation from the government of Vietnam to create a program that would enable poor villages to solve the problem of childhood malnutrition. Because the government of Vietnam didn't have the resources to address the problem of ongoing malnutrition in 10,000 villages, a strategy had to be identified to enable these communities to somehow solve the problem themselves. Positive deviance was explained in 4 identified village pilot sites as an approach that could help them address the problem of malnutrition through the identification of solutions which already existed within their community, showing them how to independently sustain their children's improved nutritional status once they had been rehabilitated. Fortunately, the villagers had previous experience with the supplementary food program initiated by a United Nations agency. They explained that when the project was finished, they had to do without the donated foods, and their children became sick and unhealthy again. So they embraced the idea of positive deviance wholeheartedly. Because we sought solutions to the problem of malnutrition which would be accessible to everyone and the most vulnerable in the community, the volunteers were asked to do a socio-economic ranking of all the children on their weighing lists. With no preset categories, the volunteers chose poor, and very, very poor as the most accurate description of the economic status of families in the community. When they completed their ranking, we met with the volunteers and asked them to study their lists to see if any of the well-nourished children came from very, very poor families. They looked at their notebooks, and several volunteers literally jumped up from their benches. Yes, there are some children from very, very poor families who are well-nourished. Do you mean, we asked, that it's possible today for a very, very poor child in this village to be well-nourished? It is, came the reply. It was clear that the discovery of the solution by those who needed to believe it already existed was immensely powerful. From the very onset of the program, it enabled the community to feel ownership for discovering the solution to their own problem. Visiting positive deviance homes in each village, homes where children were not malnourished, and observing the behavior in each home resulted in the discovery of several uncommon behaviors which the positive deviants were using. In every instance where a poor family had a well-nourished child, the mother or father was collecting tiny shrimps or crabs or snails, the size of one joint of one finger, from the rice paddies and adding these to the child's diet, along with the greens from sweet potato tops. Although readily available and free for the taking, the conventional wisdom held these foods to be inappropriate or even dangerous for young children. Along with these food and atypically strict hand hygiene in 5 of the 6 positive deviant households, other positive deviant behaviors emerged, involving frequency and method of feeding and quality of care and help-seeking behaviors. For example, most families fed their young children only twice a day, before parents headed to the rice fields early in the morning and late afternoon after returning from a working day. Because these children under 3 years of age had small stomachs, they could only eat a small % of the available rice at each sitting. Positive deviance families, however, instructed the home babysitter, an older sibling, a grandparent, or a neighbor, to feed the child regularly. Their kids were fed 4 or even 5 times a day. Therefore, using exactly the same amount of rice, the positive deviance kids were getting twice the calories as their neighbors, who had access to exactly the same resource. This was the first of countless examples that positive deviance practices often reflect not only what is being done differently, but how it is being done. Building on these insights of what contributed to positive deviance, a process was designed for others to experience and practice this new knowledge. For 2 weeks every month, mothers or other caretakers would bring their malnourished children to a neighbor's house for a few hours every day. Together with the help volunteer, they would prepare and feed an extra nutritious meal to their children. But we still faced the challenge of ensuring that they continue those practices at home after the sessions. It was the concern for the sustainability of behavioral change that led to the introduction of the mandatory daily food contribution component of the nutrition sessions. Every day, each mother or caretaker was required to bring a handful of shrimps, crabs, or greens as the price of admission to the sessions. For 2 weeks every month, someone in the family, a spouse, an older sibling, for example, had to go out to the rice paddy early in the morning and ankle deep in the mud, collect the required shrimps and crabs. By the 15th morning, when the 2-week program was over for that month, the trip to the rice paddy with a small net and empty tin can had become routine and was continued. At the house, the caretakers of malnourished children, very often an older sibling was the secondary caretaker, also practiced cooking new recipes with the help volunteers and also learned and applied basic health and child care practices. The sessions also provided an opportunity to practice other successful behaviors such as active feeding and washing the caretakers and children's hands and feet with soap and water before and after eating. This focus on practice rather than knowledge has proven to be a key element in bringing about lasting behavioral change across the range of issues addressed using the Positive Deviance methodology. It's easier to act your way into a new way of thinking than to think your way into a new way of acting. Sums it up quite nicely. Participating children were weighed on the first and last day of the nutrition sessions in the presence of caregivers and village leaders. 75% of kids put on weight during each session. The kids who reached normal nutritional status during the nutrition sessions graduated, and those who remained malnourished were signed up for the next one to be held the following month. In June 1991, just 6 months after arriving in Vietnam, an evaluation was conducted by the authorities. Just over 600 children had participated in the first 4 nutrition sessions, and 245 of these kids, more than 40% of those who had participated in the program to date, had been rehabilitated, and another 20% had moved from severe malnutrition to moderate malnutrition. By the end of the first year of the program, more than 1,000 children had been enrolled, and more than 80% of them had graduated. One of the key factors that makes Positive Deviance effective is that it is based on successful behaviors of individuals and groups within the socio-cultural context of each program community. It is always, by definition, culturally appropriate. It is very much an approach, not a model. This feature of Positive Deviance provides an antidote to the pervasive challenge of scaling up successful models, which more often than not fail when they are transplanted in foreign soil. Positive Deviance nutrition program, in contrast, has been successfully adopted and adapted in the last decade by ministries of health, UN organizations, and local and international NGOs in 45 countries in Africa, Asia, Latin America, and the Middle East. The program was a resounding success. Let's review the Positive Deviance elements from this story. Even among the very, very poor, children were identified who were not malnourished. Specific Positive Deviance behavior was observed and identified in their homes. A process was established where others in the same village could practice and adopt these new behaviors, creating new habits around diet, hygiene, and eating frequency. This program was able to demonstrate success within 6 months and has been replicated in over 45 countries around the world. Another case study from a different context and on a different issue shows how organizational cultural change can be facilitated through Positive Deviance as an effective way of disseminating behavior change, and how behavior change can spread through a large, complex organizational system. Again, the basic premise of Positive Deviance is that solutions to seemingly intractable problems already exist in the communities facing the problems. These solutions are frequently hidden in the practices, behaviors, and experience-based ideas of the people who deal with the problem directly on a daily basis. When it comes to hospital-acquired infections, this means frontline staff, not just physicians and nurses, but housekeepers, food service workers, patient transport technicians, respiratory therapists, pastoral caregivers, patients, families, and others. Simply stated, it includes all those who touch patients and environmental surfaces with their hands, clothing, and shared equipment. The VA Pittsburgh healthcare system began using Positive Deviance in 2004 to reduce hospital-acquired infection, methicillin-resistant Staph aureus, or MRSA. Upon demonstrable improvement in MRSA transmission and infection prevention at the VA hospital in Pittsburgh, the project was expanded to 5 additional VA hospitals in Pennsylvania, Texas, Maryland, and New York. The VA went on to support the incorporation of the Positive Deviance approach in its MRSA eradication bundle in all 153 Veterans Administration hospitals nationwide. The bundle, which was based on published guidelines, comprised universal nasal surveillance for MRSA colonization, contact precautions for patients who were carriers of MRSA, hand hygiene, and an institutional cultural change whereby infection control became the responsibility of everyone who had contacts with patients. 2 stories from the case study illustrate this. One, there was a meeting where data was being presented to senior management about the Positive Deviance initiative. Typically, at a meeting presenting to senior management, an expert on the data or somebody close in the organizational chart to the senior manager would make the presentation. The person making the presentation at this meeting was a member of the janitorial staff at the hospital. They were involved, included, and a valued participant in the fight against hospital-acquired infections. Another example, they were discussing the program with the pastor at a hospital. Partway through the discussion, the pastor stopped and realized, my goodness, in my efforts to provide spiritual care to people, I've been spreading the infection. Often he encouraged patients to hold his Bible or to read his Bible. And in doing so, he realized that he was carrying germs from one to the other. So the pastor, they developed some cloth covers or some other types of covers for their Bible that could be cleaned and stop being a carrier of infection. The recommended approach to achieve cultural change was positive deviance, a problem-solving approach that is based, again, on the observation that in every community there are certain persons or groups whose uncommon behaviors or strategies, as compared with those of their peers, enable them to find better solutions to problems. The goal of the culture change was to foster alterations in practice so that infection control and prevention would become the responsibility of everyone involved in the care of patients, and thus a natural component of patient care. This project was published in the New England Journal of Medicine and reported over a 32-month period a 62% drop in the MRSA infection rate in intensive care units and a 45% reduction in MRSA infection rates in non-ICUs. MRSA infection rates continue to decrease each year in participating hospitals. This is due to the fact that the frontline staff owns the solutions. Currently, over 200 hospitals in the U.S., Canada, Colombia, and Brazil are using positive deviance to prevent MRSA infections with comparable results. Key elements of positive deviance in this case study include identifying hospitals who were able to reduce MRSA infection rates. Well, for most, it was accepted as an inevitable and growing problem. Identifying the behaviors and practices, including the culture of infection control in these hospitals that created the positive deviance. Creating a process whereby other hospitals could learn and adopt these same behaviors, practices, and cultures. Knowledge doesn't advance practice, rather practice advances and internalizes knowledge. And for it, this program spread from the VA hospital to over 200 hospitals around the world. In addition to these case studies, we would like to tell you of our own work with positive deviance. We are currently working on a project to create a 5-year strategy for food security for 44 unreserved communities. When first presented with this opportunity, positive deviance suggested itself as a methodology of choice for the following reasons. 1, it was a way of respecting what the communities were already doing well. 2, it was a culturally appropriate approach. So it was spreading their solution instead of imposing a solution or suggesting a solution from a different context or culture. 3, it was a more sustainable approach. I've been involved with other food security projects where we brought in a program based on an external best practice, a really good best practice. It lasted as long as its funding did and had at best marginal long-term impact. Positive deviance instead offers a way of building capacity without creating dependency on funding, as once the positive deviance has been identified and the process for practicing this new knowledge established, the process of discovery can be iterative as many times as is needed to help spread this knowledge in new communities or populations within a community. This creates another benefit because the funding requirements to establish this framework and sustain it are much less than in a conventional program design and delivery approach. Positive deviance approach for this project consists of 1, defining the problem of food insecurity in First Nations communities, what the norm is. 2, determining where positive deviance exists, people or communities that are food secure, even in areas predictive of high food insecurity. 3, discovering the uncommon practices, behaviors, traditions, and or knowledge that enables these positive deviants to be food secure. And then 4, designing a way for other persons and communities to access and practice these behaviors, including a pilot of this process. Our project will work to identify the positive outliers in First Nations communities, those individuals or areas that are food secure even in conditions predictive of food insecurity and what makes them so. This will establish the upper range of outcomes, recommendations, and targets of what is reachable within First Nation communities in the region and help set the outcomes and targets for food security initiatives for all First Nations communities and the positive deviance process that can help communities progress towards these objectives. We are currently in the middle of this project and will have results to report somewhere close to the end of this year. So if you're interested, stay tuned. We'll be providing updates. Now, if you found these descriptions of positive deviance and positive deviance work compelling, you may be asking yourself how you can apply positive deviance in your own work. Equiate has developed a framework to guide the application of positive deviance, which we are happy to be sharing with you now. This framework will also be available as part of a discussion paper we have authored for this webinar, exploring the potential of positive deviance. This discussion paper is currently being finalized and will be emailed to all webinar participants shortly. The framework consists of two phases. First, identifying the positive deviance, and second, disseminating the positive deviance. First phase, identifying the positive deviance. This phase of the framework begins with a description of your issue or problem. What is your issue and what is your target population, those affected by this issue? Also, what do you know about the extent of this issue? What does data say about how big an issue it is and who it is affecting? This is the first step, creating a picture of the current situation. It is best done collaboratively with those in the community, organization, or system experiencing or affected by the problem. This will be in contrast to normally where it may be data analysts or others who create a picture of the problem. It's best done with the community itself to help them engage and own the problem and the process to address it. Here the framework pauses our work to assess and confirm that our problem is one that can be addressed through positive deviance. Remember that the positive deviance approach is not suitable for everything. Positive deviance will be unnecessary when a technical solution, for example, drought-resistant corn or a vaccine, exists. But the process excels over most alternatives when addressing problems that 1. Are enmeshed in a complex social system, 2. Require social and behavioral change, and 3. Entails solutions that are rife with unforeseeable or unintended consequences. It provides a fresh alternative when problems are viewed as intractable or other solutions haven't worked. It redirects attention from what's wrong to what's right, observable exceptions that succeed against all odds. If your issue matches this description, relying on social and behavioral change, then the application of positive deviance is appropriate. The next step is to go out and listen to those in the community, organization, or population affected by the problem, to learn what is considered normal behavior or knowledge in relation to this issue. This is time-consuming, but important because this is also a step in engaging people in the discovery and creation of solutions to their own problem. Listening is a process of effective engagement that builds the foundation for future sustainability. With a clear picture of the issue, and having listened to those in the community affected by the issue, the next step is to identify the positive deviance. In a community affected by an issue, who is an outlier? Once the outliers are identified, they are visited and observed to identify their behaviors or knowledge that gives them a different outcome. Observation is key here, as people often aren't aware of what they are doing that is different. This completed, the phase 1 of identifying positive deviance is complete. The focus now shifts to figure out how to disseminate positive deviance. Phase 2, dissemination. Disseminating positive deviance requires the creation of a process or system where people can experience the new knowledge or behavior rather than being informed about it. Knowledge alone is not enough to change behavior. Creating a system to foster learning by experience is best facilitated through guided mentorship of those targeted for behavior change by the identified positive deviance. This mentorship is short-term and focused. Its objective is to create a new way of doing that leads to a new way of thinking about an issue, essentially changing habits, creating a new pattern of living or working that overcomes the problem, creating a new positive deviance, and repeating this process until ideally positive deviance disappears as it has become the new normal. There are many strategies for creating this type of system and mentoring experience, tailorable to the specific organizational and cultural context one finds oneself within. The key is to walk through this whole process as a guide, helping the organization, community, or population you are working with discover the positive deviance itself and create its own method for learning and spreading the positive deviance. Because of this, every project looks different, and every project is developed and owned by those it is intended for. This is the magic of positive deviance, finding what already works in a system or population to address a serious problem and helping create a process to disseminate this solution internally. And the final step, of course, is evaluating the impact of this process. Can you identify immediate results? What impact do you see on your issue? This concludes the presentation portion of our webinar today. We hope you found this exciting and are looking forward to applying positive deviance in your organization and on the issues you face in your work. We will now open the webinar to questions for the remaining time we have left. Thank you for your questions and interest today. We are at the conclusion of our time for today's webinar. We have recorded this webinar and it will be available on our website and our webinar archive shortly. As a thank you for those participating in today's webinar, we are not only providing you with a free copy of our discussion paper on positive deviance, we are also extending an offer of free consultations focused on your positive deviance efforts. You may be familiar with Google's 20% rule, where they give their engineers the autonomy to focus 20% of their time on their own ideas related to their work. This opportunity for autonomy has created the context from which Gmail and Google News, for example, have emerged. At Equiate, we have adopted a similar practice and call it our 4-hour rule. We've described it on our blog. The idea is that every week we set aside at least 4 hours in which to focus on conversing with others about the issues they are working on, as a means of offering an opportunity for reflection and dialogue for those working in this field. At present, we have committed to dedicating these 4 hours to follow-up from our webinars. What that means for you is that if you have found positive deviance to be an interesting topic and would like to explore possible application in your organization further, we are available for free consultations through our 4-hour rule to explore this with you. Simply contact us by email. We can go ahead and schedule a consultation. We would also appreciate your feedback on today's webinar. We'll be sending you a brief evaluation survey as soon as our webinar is completed. If you would take the time to complete the evaluation, we would appreciate it. Thank you again for your participation today, and we look forward to future conversations with you about positive deviance and to seeing you in our continuing series of webinars for those working to solve health and social problems. My name is Steve Peterson with Equiate, signing off for today's meeting.